Good evening and greetings from Sunitra Family Eye Care Center, Kolkata. I, Dr. Amitav Vishwas, Director of Sunitra Family Eye Care Center, today bring to you the 12th episode of our weekly patient education series. Every week, we select a topic based on importance and relevance from the patient's point of view. Today's discussion shall be centered around the fact that World Diabetes Day is celebrated every year on the 14th of November. 3 more days to go. So we thought a discussion on diabetes and its effect or relevance to the eyes would be a good topic to discuss. Our center was one of the first in Kolkata and perhaps in Eastern India as well to commission a dedicated diabetic eye disease clinic way back in 2010. The dedicated diabetes eye disease clinic was established and is still run by an eminent and promising young ophthalmologist colleague, Dr. Sugata Paul. Dr. Paul was Director of Diabetic Retinopathy Screening and Management Services at Wigan Leigh and Wrightington NHS Foundation in the United Kingdom for many years before he decided to return to his hometown Kolkata. And here, we were lucky to get him to set up the Diabetic Eye Disease Clinic here. Dr. Paul has published several scientific publications in peer-reviewed journals, lectured widely in national and international meetings. He is a recipient of S. Das Ghosh Memorial Award of Ophthalmic Society of West Bengal and Muralidhar Memorial Award of Kolkata Academy of Ophthalmology. With these few words of introduction, I heartily welcome our colleague and team member, Dr. Sugata Pal. Hi, Sugata.
Hello, and thanks for the very kind words. And thank you for organizing this awareness program on diabetic eye diseases. Thank you very much. It's a much program.
Sugata, let us kick off the discussion. এই যে World Diabetes Day 14th November is celebrated to create awareness. So how big is the problem of diabetes around the world? এটা সম্বন্ধে তুমি যদি একটু দর্শকদের জানাও।
Yes, while I start sharing my screen, just to go back to a little bit of history. World Diabetic Day was started being celebrated in 1991. And it was then in 2006 it was taken up by UNO and was officiated, and it is actually celebrated to the birthday of Charles Frederick Banting, who was actually the inventor of insulin in 1922, when a lot of people used to die out of diabetes. So just give me few seconds and I'll share my screen.
Correct. Sure. তো আমরা যেহেতু বুধবার করে এই লাইভ ফেসবুক লাইভ প্রোগ্রামটা করি বলে আজকে করছি। ওয়ার্ল্ড ডায়াবেটিস ডে 3 দিন বাকি আছে, বাট দেন অ্যাওয়ারনেস শুধু বছরে একদিনের জন্য তো হয় না, অ্যাওয়ারনেস প্রত্যেক দিনের জন্য অ্যাওয়ারনেস থাকে।
Exactly, yeah. So before I start my talk, we have to neither myself nor any member of the family Sunitra Family Healthcare Center have any commercial interest of any of the products or technology we'll be discussing in this meeting, even if I mention it inadvertently.
Share হয়নি এখনো সুগত, স্ক্রিনটা এখনো শেয়ার হয়নি।
It's showing shared here. It's sharing your screen.
Acha.
Is it showing there?
No, it is not showing in.
Okay, so what I'll do, I'll stop share and reshare again.
এবারে হয়েছে।
Okay.
Yes.
So now coming to the epidemiology of diabetes, as you were asking, 46 crores of adults have diabetes according to the data which is available in 2019. That means every 1 out of 11 people, they have diabetes, that means huge problem. Yeah, and 1 in 2 adults actually remain undiagnosed. So we are probably seeing the tip of the iceberg, maybe. And 2/3 of the diabetics live in urban area. So probably it might be a more of a lifestyle problem, which will come later. And 3/4 of the diabetics are in the working age group. So this is one important thing we have to keep in mind. When a person who is supposed to work and earn the living for his family, he or she is getting diabetes and going to the doctors, getting treatment, going to different doctors for different problems created by diabetes. So much of working day is lost every year due to diabetes. And 4.3 million death was due to diabetes in 2019. And if we think about the healthcare spent, a lot of our healthcare budget is spent on diabetes. In fact, 10%. There are probably thousands and thousands of diseases, and one single disease consume 10% of the total spent in the healthcare worldwide. So it's a huge problem. And you know what? India is predicted to be the capital of diabetes in few years' time. It's probably almost the capital now. So it's a huge problem.
আচ্ছা,
Now,
একটা একটা প্রশ্ন
yes,
আমার মাথায় এলো।
হ্যাঁ বলুন।
You showed that 3/4 of diabetics are in the working age group. তার মানে
Yes.
one-fourth of them are in the younger age group তার মানে।
Yes. One-fourth of them are in the younger age group, or maybe over, if we take 65 as the working age, then they can be over 65 as well. So three-fourth of them are between, say, 20 to 65, and rest of them are outside that age group.
Okay, carry on, তোমার বাকিগুলো দেখাও।
So, if we come to the next thing, how diabetes can affect us, again, this is alarming. So, diabetes actually doubles the risk of the stroke. So, if I am susceptible to stroke, the chances become twice if I'm suffering from diabetes. It also multiplies the risk of the heart disease by 4 times, and is also the leading cause of non-traumatic, means we lose our extremity from accidents or trauma, but leaving that out, diabetes is the leading cause of non-traumatic lower extremity amputation, means where we have to get rid of the extremity, which is very unfortunate event. And every 33 causes 33% of the new cases of end stage renal disease, means where patient might require kidney transplant. There are other causes of that as well, but diabetes actually occupies 1/3 of this problem of the
এখানে
renal.
lower extremity amputation যেটা বললে, that basically refers to gangrene of the feet, right?
Yes, right. That's right.
আর তুমি যেটা বললে যে ডায়াবেটিস doubles the risk of stroke, তো এই একটা
Yes.
কথা আমার মনে হলো, এখন এই কোভিড সিচুয়েশনে এমনকি কোভিড ইনফেকশন হলে পরে যে ইন্টেন্সিটি অফ ইনফেকশন বা ইন্টেন্সিটি অফ সিমটমস বা ডিজিজ ইজ অলসো এনহ্যান্স যদি কারো ডায়াবেটিস থাকে, তাই নয় কি?
Exactly. So a patient who is diabetic, their outcome is poor. So they has to ensure, everyone, because we don't know who will get COVID or not, everyone has to ensure proper diabetic control in this period.
এটা চোখের কথা বলো, চোখে ডায়াবেটিস
চোখের কথা আসার আগে just again, as I have said, diabetes is the leading cause of blindness in the adult, in the working age group, and is also, as I have said earlier, it has considerable impact on both the patient and also to the society, because it's typically affect the individual in their productive year when they're supposed to work and earn their living. It affects them mostly. So by diabetic eye disease, we sometimes mean diabetic retinopathy, but it is actually not just about diabetic retinopathy. In fact, diabetes can affect each and every structure of the eye. It can affect the cornea, the lens, the vitreous, the iris. It can affect the muscle, the optic nerve. It can affect each and every structure of the eye.
This is a wonderful piece of information, সুগত, কারণ বেশিরভাগ পেশেন্ট এবং জেনারেল পিপল, বেশিরভাগ লোকে জানে যে ডায়াবেটিস হলে রেটিনাতে এফেক্ট করে, মানে চোখের যে এতগুলো স্ট্রাকচারেও এফেক্ট হতে পারে। এটা খুব ভালো পয়েন্ট মেনশন করেছো।
Yes, so as a clinician we are aware, but a patient, they need to be aware as well. It's not only about retinopathy. They can get early cataract. I'm coming to those things. They can get recurrent stye. Stye is a very painful condition where you can see the lid is being swollen and there is a pass point. That is a very painful condition, and they can get recurrent stye. So getting one stye okay, we'll manage, but it keeps coming back. So diabetic patients are more prone to this. And then next, they can get corneal ulcer. Corneal ulcer, because diabetic patients are more prone to infection, and if you get corneal ulcer, it's very difficult to treat, and patient can sometimes even lose their eyesight. So it is very important that we are aware of this problem. If there is any redness, if the patient notice any white patch on the back of their eye, they should consult their eye specialist immediately. Next is quite often fluctuation of the blood sugar can lead to fluctuation of the eye power. So quite often what happens, patient comes to us and says, ডাক্তারবাবু আমার চশমাটা 6 মাস আগে করিয়েছিলাম পাল্টে গেছে, একটু কাইন্ডলি আমার নতুন করে পাওয়ার করে দিন. But
Correct.
we have as a physician, yes, sorry, yeah, go on, Dada.
না না
You were
তা-
asking, yeah.
একদম
So,
correct.
as a clinician, we have to educate the patient that if the blood sugar is not controlled properly, then the power will keep fluctuating and they will end up changing their glasses every few months. So, it is important to get the blood test done, control the blood sugar, and then go for new glasses in these situations.
So
And also,
তার মানে for every diabetic patient, before changing the glasses or ordering new glasses, they must get the blood sugars checked and ensure that it is stable, right?
exactly. This is a very important point you have brought out. Exactly. They should get their blood sugar tested before they go to their ophthalmologist to get their power changes.
Correct.
Okay. So next is the cataract. Again, diabetic patients are more prone to get cataract. In fact, it has been shown that in diabetic patient, cataract comes a decade before the normal patient. So if I was supposed to get cataract at the age of 60 years, I would probably get cataract at the age of 50 years. So diabetes do cause cataract, increase incidence of cataract as well. There are several types of cataract which are more common in diabetic patients. And then it can cause double vision by paralyzing the muscles of the eyes, which actually move our eyeball. Now, the brain controls the movement of the eyeball, and diabetes can affect the nerves, which, if get damaged, can stop the movement of the muscles, and we end up getting double vision. So, diabetes is also important cause for this. There are several other causes, but diabetes is one of the most important cause for this.
Mhm.
But again, as I was saying, diabetic retinopathy is the most worrisome problem of diabetes. Leaving aside cataracts, tie, and the regular change of power, leaving them aside, retinopathy is what which can lead to blindness in the working age group. So we have to be aware of this problem.
I think the main reason is that retinopathy, once it sets in, it's unlikely to be reversed. We can at best attempt to arrest it further worsening of the retinopathy, right?
Exactly, that's right, that's right. And if we think about which type of patient will get diabetic retinopathy, it has been shown that type 1 diabetic means those who depend on insulin, they have 70% chance of getting diabetic retinopathy, whereas type 2 diabetic, that means those patients who takes tablets for diabetes have 39% chance of getting diabetic retinopathy. But the same group of patient, if they end up taking insulin because of poor control, again their risk goes up to 70% of getting diabetic retinopathy in their lifetime. So that is very important, that patients who request insulin means, for a layman's term, they are worse patient and their chances of getting retinopathy is much more.
আচ্ছা, এই রেটিনোপ্যাথির কথা যেটা বলছো,
Yes,
রেটিনোপ্যাথি যখন যদি পেশেন্ট কি কোনোভাবে বুঝতে পারবে যে রেটিনোপ্যাথি হয়েছে বা কোনো সিমটমস দেখে, নাকি সিমটমস কি সবসময় হয় না? ক্যান ইউ টেল অ্যাবাউট দ্যাট ফর দ্য পিপল?
yes. That is a very important question you have asked, because they can come to us only if they have symptoms, isn't it? So this is a very important question. But unfortunately, in diabetic patients, actually, most of the time they don't get any symptoms. So all the patient, everyone who is listening to this program or watching this program, has to remember that very rarely they get symptoms. If they get symptoms, that means the disease is quite progress. And what symptoms do they normally get? They can get floaters from bleedings from the vessels, or they can get black patches. So if you look at this picture, in the normal patient, if he or she is seeing this one, a patient who has patchy bleeding in the retina can see parts of the picture missing. So these are symptoms which they can see, but that is quite rare. Patients are quite often asymptomatic, and that's why it is important to have diabetic retinopathy screening. I'll be coming to that, but before that, I'll just to highlight which sort of patients can get worsening of the diabetic retinopathy. We have to look at the risk factors. Now, duration of diabetes, we have no control on. Okay, if I'm diagnosed diabetic earlier, I have to live with diabetes lifelong. And hence, if I am diagnosed diabetes, say at the age of 20 years, and if I'm living till the age of 70, so of 50 years I have to live on with diabetes. And every year, the cumulative risk of getting diabetic retinopathy increases. So the duration of the diabetes is something which actually increases the risk of diabetic retinopathy, but unfortunately, we have no control on that. But what we can control is diabetes, because poor control of diabetes can worsen the diabetic retinopathy. High blood pressure, if it is not controlled properly, can worsen the diabetic retinopathy. Kidney problem, then obesity means if you have a lot of unnecessary fat in the body, if you are overweight, and if your cholesterol and lipids are not under control, they can increase the risk factors. Smoking, unfortunately, increases the progress of diabetic retinopathy, and pregnancy and also anemia in female patient does increase the risk of progression of diabetic retinopathy.
সুগত একটা একটা
Yes.
রিকোয়েস্ট করি, একটু আগে
Yeah.
তুমি ফ্লোটারের কথা বললে, এই
কিসের?
ফ্লোটারটা যদি কমন ম্যানের জন্য একটু ডিসক্রাইব করে দাও যে হোয়াট এক্স্যাক্টলি ইজ আ ফ্লোটার, পেশেন্ট কি দেখে অ্যাকচুয়ালি, কি
Yes, actually, we normally also floaters can be present. Quite often, patient sees a black spot in their vision, especially when looking at the bright light. And in diabetic, if there is floater is caused by bleeding, they can see sudden showering of black spots in the vision. Now, floaters, as I was saying, can happen due to other reason as well. There are some age-related disease like posterior vitreous detachment. If we have time, just give me 1 minute or half minute to explain that. So, what happens in posterior vitreous detachment? The jelly in front of the retina separates from the retina and settles down, and that can give rise to floater as well. And again, no financial interest. At Sunetra, we have the machine by which we can break these large floaters, which can annoy the patient. The large floaters can annoy the patient. Small floaters, they don't annoy the patient that much, but big, large floaters can annoy the patient and is quite disturbing in the day-to-day activity. At Sunetra Eye Care, we have this machine by which we can actually destroy these floaters and break the floaters into small pieces. But before that, we do different tests to ensure that the patient is suitable for floaterectomy or not. The term is called floaterectomy, and if the patient is suitable, we go ahead and do the floaterectomy for them.
তুমি ওই স্ক্রিনিং এর কথা বলতে যাচ্ছিলে।
Yes, exactly. So as I was saying that these floaters are very rare symptoms, and in fact, even if the patient comes from with floaters, they can be due to so many other reasons as well. But what is important is diabetic patients. Most of them, diabetic retinopathy patient has no symptoms. So it is important to screen, that means to check the retina of each and every diabetics to see whether they have retinopathy or not. Retinopathy is the term which we use when the retina is damaged due to diabetic. We call them diabetic retinopathy. So screening is important. So in screening program, we might get patient without any retinopathy, and we might get patients with retinopathy. Having retinopathy doesn't mean that their vision is gone or they need treatment. In fact, a small percentage of the patient will need treatment. I'll come to that later on. But how do we screen? We can screen. Ophthalmologists they screen by using different machines like the direct ophthalmoscope, indirect ophthalmoscope, and we can do slit lamp biomicroscopy. And in Western country and even in Sunetra, we have the opportunity of very advanced digital fundus camera by which we can capture the image of the retina and we can document that. It not only helps to check year on whether the disease is progressing, but for the patient also they can see their eye and they can, and as you know, seeing is believing. So when they see the damages in the eye, they get more inspired to control the parameter which I just discussed previously, like the control of blood sugar, blood pressure, obesity, all these things. They get inspired that okay, ডাক্তার বাবু আমার চোখের রেটিনায় তো ড্যামেজ এসছে আপনি দেখাচ্ছেন, okay, I will take now. I was bit negligent till now. I will now look at these parameters as well. So digital fundus photograph, which we have the world class camera at Sunetra, is an important, very important measure. In fact, in UK, 90% or in fact 95% of the patients are screened in this way. That actually saves the time for the doctor as well, because not all diabetic retina needs to be seen by an ophthalmologist if we have a good diabetic screening program as we have in here in Sunetra Eye Care. So these are the way of screening diabetic retinopathy. Now, what do we screen? As I have said, we basically screen the retina to check what sort of damage they have. And I'll just show some pictures of retinopathy. Now, if we look, and I'll come to a normal retina picture later on. If we look at this picture, this is the optic nerve, and these are the blood vessels of the retina. So, retina is the only structure of the body where we can look at the blood vessels directly, and we can pick up so many diseases like diabetes, like the changes of the blood vessels, diabetes, blood pressure related damages, so many things we can pick up. And on diabetic retinopathy, what happens? From the blood vessels, small hemorrhages can appear on the retina. You can see these are called dot hemorrhages, and some bigger hemorrhages can affect in the retina. So, Amitabh, this patient, if I take this patient already has so many damages. Yeah, bleeding here, bleeding almost every here. Or coming to this patient, okay, I'll come to that. So, he has damages in the retina. So, he has retinopathy. But if you ask me what will be his vision will be absolutely normal. So he
Correct.
might not know that he has this damage inside the eye, and he
Correct.
might not take precautions. So that's why it is important to screen patient on regular basis. Annual screening is very, very important, and it is not only the patient awareness but also the physicians, the endocrinologists. They should be aware that even if the patient tells them that they don't have any eye problem, still they need screening, because the eye problem might be just going on but not exactly at the center, and at any day it can affect the center. Like in this patient, it is magnified image to so that people can see here. This is the area which we call fovea, through which our maximum vision is, and you can see a large white area. These are actually nothing but fat coming out from the blood vessels, getting deposited on the retina, and once the fat comes onto this portion, the patient loses vision. Till
Correct.
now, patient's vision is absolutely 100% because this area is clear. So the patient's vision is absolutely 100%, and he might not know that he might lose vision within a month or so. So if we can screen the patient, we can. There are various way of treating the patient, which I'll come later on, but we can preserve and prevent blindness in this patient.
Correct.
And next is a very advanced stage of retinopathy, which we call in our medical term proliferative diabetic retinopathy.
Ah,
We shouldn't get patient at this stage nowadays, because awareness should be in such a level that patients are detected and treated before coming to this stage. In this stage, new blood vessels, you can see this so many irregular red lines. These are actually new blood vessels. What they are doing there, they are trying to helping the retina by bringing more oxygen to the retina, because what happens in diabetic retinopathy, the blood vessels can get narrow, the oxygen supply can get affected. So these new blood vessels, they grow to supply oxygen to the retina, but problem is that they are very weak and they can lead to bleeding, like this bleeding in the jelly of the retina or inside the retina, and can lead to abrupt loss of vision. So no patient actually in this turnage, no patient should go to this stage. So
Very
important thing
well,
is
very
screening.
well
Yeah.
said that no patient should reach this stage, because if there
Yes.
is regular screening, it
Yes.
should not happen. Yes,
So this is, but unfortunately, the awareness is still not there, and that's why I thank you for organizing this awareness program. So if any one patient learns today, and he or she might spread this message to another 10 patients, and that's how the awareness grows. So it is
absolutely
very important to conduct this sort of awareness program, Dada. Thank you so much. And this is very advanced stage. Whatever treatment we do in this stage is very very difficult to get the vision back, because the retina is being pulled out of the place by what we call tractional retinal detachment, because the disease has progressed so far, not being treated or not being diagnosed.
correct.
So as I was saying, if we look at this picture on the right hand side, this is a normal retina, the optic nerve, the blood vessels, and there is no bleeding here. And if we progress slightly there, you can see the phobia is clear. There are some bleedings here and there. There is some leakage of fat here and there. And then if it progress further, new vessels are growing in the retina from the optic disc or elsewhere from the blood vessels in the retina, which is the severe form or the proliferative form of the retinopathy.
Mhm.
Now, once we diagnosed, how to decide whom to treat or whom not to treat.
Correct.
So it is important to have this machinery in our setup, which we call ocular coherence tomography. And again, Sunetra, if you will be better positioned than me to highlight, I think Sunetra was the first institute in Eastern India to have the Heidelberg OCT, which is regarded as the best in the field. Is that right?
So, Gautam, we were the first in India.
Yes,
The
okay. The first in India to have Heidelberg. Heidelberg is a German company, and we all know German leads the world in this sort of technology. And Heidelberg OCT, they are very accurate in diagnosing retinal diseases. And not only that, if I am correct, we have an additional tool which is called Heidelberg OCT angiogram. Am I right,
yes,
Dabra? Yes,
yes,
I'll come to that later on. So OCT is the tool to diagnose retinopathy. So if we see, it's basically taking a biopsy of the retina. So what we do here, this is a normal retina. We can see all the layers of the retina, and in fact, the layer below the retina can be visible very well with the Heidelberg OCT, which is not visible with many other OCT machine. So Heidelberg gives that advantage to look at not only at the retina but also the layer below that, because there are a lot of disease which affects the choroid as well. So once we can decide which retina is normal, then we can look at retina which are abnormal here. And here you can see this retina is all swollen up. There are hyperreflective spots in medical terms, and there are dark spots which are fluid, collection of fluid in the retina, in the superficial layer and also in the deeper layer. So this retina is in mess actually, and this retina needs treatment. So the OCT is one of the way to tell us which retina or which patient will require treatment and which patient can be observed. The
correct.
next is the DFA or angiogram. What we do in angiogram, we inject fluorescent dye in the retina and we take several pictures of the retina, and here if you see, the dye goes onto the blood vessels and is reflected, and here we are taking the pictures, and on the left hand side, if you compare, you will immediately see the differences, that there are several hyperfluorescent, in medical term we call hyperfluorescent spots, because this is the fluorescent dye we are using. There are several leakage on the retina. So again, this retina is in mess and needs to be treated.
বেসিক্যালি
So
বেসিক্যালি ডায়াবেটিক রেটিনোপ্যাথিতে তোমার যে স্মল ব্লাড ভেসেলস গুলো থাকে, যেগুলোকে আমরা ক্যাপিলারি বলি,
yes,
ওইগুলোর ওয়াল গুলো বোধহয় ড্যামেজড হয়ে যায়, তাই তো? সেই জন্য
exactly.
হচ্ছে, তাই তো?
ওয়ালগুলো ড্যামেজ হয়ে যায়, সেখান থেকে লিকেজ অফ ফ্যাট হয়, লিকেজ অফ ফ্লুইড হয়, লিকেজ অফ ব্লাড হয়, অ্যান্ড বিকজ অফ দ্য ড্যামেজ, বিকজ দ্য অক্সিজেন সাপ্লাই গেট অ্যাফেক্টেড, নতুন ব্লাড ভেসেলসও তৈরি হয়।
Correct.
Another thing which I would like to mention at this point, DFA involves injection of fluorescent dye in the hand, and very rarely patient can be allergic to that. As I was telling earlier, OCT angiogram, which again we are one of the first center to have Heidelberg OCT angiogram in India, that also give the same sort of picture, but here no dye is required to be injected, so the patient is much safer with this option of OCT angiogram.
Correct.
So these are the three tools which helps us to diagnose the disease and decide whether they require treatment or not.
Okay.
So coming to the treatment, again, this is another DFA picture, which, as I have said, there are several leaking points in the retina. So, and in various stages of the process. So coming to the treatment, the mainstay or the gold standard of treatment till now was laser treatment. So what we used to do, we used to give laser burn to the retina to stop the leakage or to stop the new blood vessels from growing. So here, if you see this patient, this is the center of the fovea, and these white spots are the laser mark which were given to stop the leakage around the fovea or the center of the vision. Because if the leakage reaches the center of the vision, it can lead to blindness. So this was the gold standard of treatment till now. I'm coming to what is the gold standard now in few seconds. So this is called macular grid, where the laser was done to stop the leakage reaching the fovea. The other form of laser is pan-retinal photocoagulation in our term. What happens here is basically we give laser burn to whole of the retina, because new blood vessels grows when the oxygen demand is high and when the normal blood vessels fail to supply oxygen to the retina, so the new blood vessels grows. So what pan-retinal photocoagulation does, it burns the retina, the part of the retina which is not that much required for vision. So it burns that portion of the retina to decrease the requirement of the oxygenation in that portion, so that the new blood vessels regresses. So when the oxygen demand reduces, the new blood vessels regresses. So this is another form of laser treatment.
Correct.
Okay, but now the gold standard has become intravitreal injection. It has been shown by different studies that what happens in diabetic patients, the retina secretes different types of chemical which are called vascular endothelial growth factors, and there are several other chemicals as well. So the intravitreal injection actually reduces the secretion of the VEGF. So we call it anti-VEGF injection. There are several types of injection, such as Avastin, Accentrix, Eylea. We have no financial with this, but these are the injection available. And there are also steroid injection such as Ozudex or Triamcinolone, which also sometimes are required to address the diabetic retinopathy problem. Any question you want to ask at this stage?
এই ইনজেকশন গুলো কি পেইনফুল?
No, the
But they-
injections are not painful. In fact, sometimes patients they don't even realize the injection is being given, because we use such a fine needle and we put drops in the eye which actually make the eye numb, so the patient don't feel any pain at all. But of course, pain sensation is a subjective matter. It varies from patient to patient. Some patient, they do say that very mild discomfort, but no, not painful at all. This injection are not painful at all.
এই
And
ইনজেকশনের পরে কি অনেক রকম লাইফস্টাইল রেস্ট্রিকশন থাকে নাকি?
yeah, I'll come to that. I'll come to that. Because even if it was painful, it is not painful, but even it was painful, would not hesitate to take this, because this is the vision-saving drug. Because laser treatment, it used to stop or restore or preserve the vision, but the injection has shown that in many patients it actually improves the vision as well. So it can go back, the patient can go back to their normal vision in many instances. Lifestyle changes, actually, I would say no. Some patients, they do notice the injection floating in their vision for a day or so, but otherwise I advise my patient to carry on with their normal day-to-day activity after the injections.
Correct,
And
correct.
but one important thing I would like to highlight is, I would wish no patient go to this stage where they require injection, because this is costly, because this is not a one-off treatment. They will require injection regularly. In fact, studies have shown that in the first year, if we want to treat the disease properly, in the first year, patient might require up to 11 injection, and in the second year, it reduces to 7 injection. So 18 injection in 2 years, and then it reduces to 1 or 2 injection per yearly. But unfortunately, with India, in most of the time, the Mediclaim is not covering this injection. It becomes very, very difficult for patient to bear the cost. So I would wish no patient reach this stage where they require regular injection in the retina. But I'll show a slide how the injection works. Okay. Now, this is a patient who was seen in September 2013, and you can see the retina is all swollen up. If you remember the scan of the normal patient, if you compare that, it is all swollen up. This is the deepest layer of the retina, and it is the superficial layer. You can see it's swollen up with clear spaces, means so much of fluid. And once the injection is given, the next month the patient came back, and look at the scan, how magically the retina has improved. The retina has gone back to its normal contour, the fluid had gone, the patient regains the vision. And normally this part, we measure the thickness of the retina, which should be in our term less than 250 micron, and it has come to 240 micron, so the normal retina. But as I was telling before, the patient requires regular injection, and in India it is always difficult to go ahead and take regular injection. So the patient gave gap and then came back in July after 6-7 months, came back, and again look at the retina, it has gone back, patient's vision has gone down, and the retinal thickness 700, if you can see the slide, 732 microns, so almost 3 times of normal. Injection given at this point, and again you can see the retina has gone back to normal position. So this injection is a very important tools in our hand. If the patient can afford, we can preserve the vision and we can improve the vision. So this is now has become the gold standard of treatment in diabetic retinal disorders.
সুগত, এই ধরো
Yes.
100টা পেশেন্টের এরকম ডায়াবেটিসের জন্য রেটিনাতে এডিমা রয়েছে বা ডায়াবেটিক ম্যাকুলার এডিমা, 100টা
Yes.
পেশেন্ট ইনজেকশন দেওয়া হলো, 100
হ্যাঁ।
জনের মধ্যে কতজনের ইমপ্রুভমেন্ট হতে পারে বলে আমরা আশা করতে পারি?
Actually, more than 90% they do show improvement, but there are patients, as I've said, they require multiple injections, and there are patients who don't respond. So we call them resistant cases, and in those patients we have the option of switching over to a different type of injection, or different types of anti-VEGF injection, or which we have the options of giving steroid injection, and in some patients we can add up some lasers as well. So all hope is not lost, even if they don't respond in initial few injections. They can be there are can be other injections available to treat this process, and they do response. But unfortunately, this has to be supplemented or complemented rather with the other parameters control, like blood sugar control, blood pressure control, cholesterol control, giving up of smoking, weight control. All these has to be taken care as well.
হুম।
Sorry.
এই ইনজেকশন গুলো ইউজুয়ালি মান্থলি ইনজেকশন হয়, তাই তো?
Yes, every month they have to be given to get the additive effect. They should be given every monthly, depending upon whether they're responding or not.
Correct.
In fact, best result are obtained if a loading dose of 3 injections are given, and then we call what we call treat and extend. Then we, depending upon the response, we call the patient back in regular intervals and give, especially the first 2 years, do the scan again and give the injection. There is another way of treating which we call PRN basis, where also we should give the 3 loading doses, and then depending when the fluid is coming back, patient has to come back for regular follow-up, scan has to be done regularly, and then if the fluid comes back, we have to inject the injections again.
Correct. এটা তো ডক্টরই অ্যাডভাইস করবে বা ডিসাইড করতে পারবে।
Exactly. Ophthalmologist has to look at the retina, dilated retina, should do the scan, OCT scan, and if required, do the DFA, and then decide further management of the retinal problem.
অনেক কিছু জানা গেল। আই এম শিওর লট অফ আওয়ার ডায়াবেটিক পেশেন্টস will benefit from everything that you said today. You made it clear in very simple and lucid terms. So what are our take home messages from today's discussion?
Yes. So what I would say, which I have said before as well, tight glucose control and blood pressure control can significantly reduces the incidence of the disease and number of complications which the diabetic patient gets. Okay. And diabetic, as I've said, diabetic patient should see an ophthalmologist early and often. Annually they should visit ophthalmologist annually. It's not about going and getting that power checkup, but visiting the ophthalmologist to get the retina checked, even if they are asymptomatic. So please remember, even if you have no symptoms of vision, please do visit your eye specialist annually to ensure your retina is fine. The next take home message is, as I have said, vision can now be restored in large number of patients with the treatment options available, injections and lasers. And it has to be remembered that retinopathy treatment most often is a long haul process rather than one-off episode. So be prepared for that. Don't get disheartened. Even if you get retinopathy, even if you get sight-threatening retinopathy, we can restore your vision with regular treatment. Remember, it will not be a one-off treatment. And I will leave you with a message that probably diabetes is not a disease. Probably is more of a lifestyle disorder.
তার মানে জাস্ট মানে অনেক পেশেন্ট মনে করে যে জাস্ট আমি ওষুধ খাচ্ছি ডায়াবেটিসের, সো দ্যাট ইজ এনাফ। সো দ্যাট মে নট বি এনাফ, অ্যাজ ইউ মেনশন।
That is not enough. That is not enough.
Diet, the exercise.
Exercise is very important. Diet is very important. So lifestyle management is a different, actually different thing altogether. It's not that okay, I'll do exercise, okay, I'll do diet. There is pattern of doing all these things, exercising and managing the diet. There should be a pattern which the patient should follow. If and I'm sure you can highlight this in one of another awareness program. So
we have a nutrition and lifestyle disorder specialist at our center. ওনার
Yes.
অ্যাডভাইস ফলো করে আমার অ্যাটলিস্ট 5 জন পেশেন্ট যাদের টাইপ 2 ডায়াবেটিস ছিল, তারা ওনার অ্যাডভাইস ফলো করে এখন they have got freedom from medications and insulin and they are doing fine. Their diabetes has got reversed. ওই নিয়ে আমার মনে হয় নেক্সট উইকে একটা ডিসকাশন করলে ভালোই
Yes,
হয়।
that is a great news, and if you can spread this awareness, and if you can spread some sort of message how to do that, that will be very very helpful, because in this COVID time, most of us are not even running to catch the bus to go to the office. Okay,
Correct.
we are sitting at home and doing our work from home, and obesity is increasing. Diabetes, I am sure, will increase during the COVID period. So an awareness program about the lifestyle management will be very very helpful, Dada. Will be very helpful.
সুগত, ওয়ান্স এগেন, মানে তুমি এত ভালো করে গোটা জিনিসটা বুঝিয়েছো। আই এম শিওর আমাদের ডায়াবেটিক পেশেন্টদের খুবই লাভ হবে এটা শুনলে পরে। অ্যান্ড গড ব্লেস ইউ ফর দিস ওয়ান্ডারফুল টক দ্যাট ইউ ডেলিভার্ড।
Thank you so much.
Thank you for sparing your time. And we hope that you take forward this diabetic eye disease clinic that you set up in our center forward, and it becomes bigger and larger with more patients getting valuable help from your treatment.
Thank you so much. And before I end, people might be wondering what this blue thing in each of the slide there. This is the logo of World Diabetes Day, the blue ring actually of continuity. So this is the logo which we have used, as Dr. Bishas has said, that on 14th of November we will be celebrating the World Diabetic Day. So to make you aware, this is the logo of the World Diabetic Day.
Excellent.
So thank you so much for this nice awareness program Sunetra Eye Care has organized, and thank you for making me a part of this. Thank you.
We are proud of you. Sugato, shall we end the broadcast now?
Yes, we will end the broadcast. Let me stop sharing the screen.
Yeah. Yeah. Okay then.
Thank you so much. Thank you for everyone who has spent their time to attend this awareness program.
Okay, bye-bye.
Thank you. Namaskar.
Namaskar.